Hi, good afternoon, everyone, and welcome to another episode in the online interview series presented by Leicester Politics Society. We have got a medical doctor on board today, not here to treat me, but he's here to fix UK's democracy and ailing healthcare system. We have with us Dr. Parth Patel, Senior Research Fellow at the Institute of Public Policy Research, which is quite a well-known think tank in the UK. He leads IPPR's work on politics and democracy. His research is often cited in the parliamentary debates and committees. Parth is also a regular commentator on TV and radio, having appeared regularly on the BBC, Sky News, and Channel 4 News. So welcome, Parth. Thank you for being a part with us.
Thanks, Ed. Thanks for that sort of excessive but kind introduction.
Moving on to the first question, the NHS has been facing significant challenges, including staff shortages, long waiting times, and funding gaps. So in your view, what are the most pressing issues, and does it really require a reform as suggested by both the Conservative and the Labour Party in the UK?
Yeah, I mean, it's a great question. It's a large, broad question. Let's start clearly there is something wrong with the UK's health service and England's National Health Service, right? Because we have problems root and branch. We have problems accessing timely care. We're in a country where actually quite a lot of people are living without the security of knowing whether they can see a doctor in their hour of need, right? Whether it's being able to be seen in an accident emergency department or being able to see your GP, or whether it's getting the hospital treatment you've been waiting for longer than you were told, right? There are clearly problems within the health service that have been building up probably for well over a decade now. In fact, they have been building up for well over a decade, but they were sort of precipitated by the pandemic and that sort of shifted attention politically and publicly onto what's going on. So why is that happening? Why have we got these sort of problems across accessing timely healthcare service, but also the quality of healthcare services, right? When people do see their doctor, it's quite hard to see your preferred doctor, right? If you're seeing your GP continuously, being able to see that person is increasingly more difficult. That's a sign of quality of care, and actually leads to real-time outcomes. So there's two ways of thinking about this, I think. One is on the demand side, and one is on the supply side. Or you can think about it in terms of resourcing and organization. And you have to think about both, right? I think there's a tendency, depending on who you are and what your sort of political leaning might be, you sort of take one of those. You might say, actually, there's just not enough money, there's not enough staff, we need to solve that. That's true, but that's looking at it with one eye closed. Because even if you did really increase the resource environment and you really somehow managed to get a whole load of nurses, doctors, pharmacists, and other healthcare professionals into the health service, it's worth saying that still wouldn't be an ideal type health service, right? And on the other side, there are people who talk about just reform, right? All the NHS needs is reform. There's plenty of money going into it, and all we need to do is reimagine it, rip it up, scrap the taxpayer model, whatever. There's all sorts of reforms, and that too would be inadequate, because however you want to organize a health service is completely and always conditional on the resource environment. So you need both of those things, and those are the ways to think about it. So let's start with that sort of organizational challenge. Is the health service, does it need reform? And my answer is yes, put simply, it does need reform, because it's still operating as a post-war institution, right? It was created after the Second World War, in a time where most people died of infectious diseases like tuberculosis or accidents, right? Things that were sort of make or break. You tried to stop people dying, and diseases that were largely curable. These infectious diseases you could cure with antibiotics. Now, fast forward to today, most people are not unwell with something we know how to cure. Often it's an incurable disease that we could maybe prevent, and we should do much better at preventing, but we need to learn to manage. Diabetes, heart disease, angina, cancer, Alzheimer's, right? These are the most common diseases in Britain today, not tuberculosis, not pneumonia, even though that still does exist as problems. And so you need to question, well, is a health service that was built to treat people with tuberculosis the same, still correct in its function to treat people who have diabetes? My answer to that is no. And we need to think harder about a health service that is designed to help people, to stop people getting unwell in the first place, and then once they do become unwell, to prevent deterioration, to improve management. And that looks very different. That takes you away from the hospital-driven model of surgeries and treatments, and it takes you more to a kind of healthcare that's close to people's homes, closer to people's communities, and involves patients in an active way, not in a paternalistic way, right? And those are the big questions, I think, for the health service. Let's follow the diabetes example. At the moment, the health service is almost geared up for later intervention. The way we run healthcare in England, at least, is that it makes most financial sense, or you can get the most money by treating someone with diabetes whose disease is so bad that we need to amputate their leg, because that surgery is going to bring in a lot more money than actually improving their sugar control 5 years earlier. That's a perverse incentive. We need to think much harder about that. And if we work out the systems, we're actually like, why don't we focus much more energy on improving this person with diabetes sugar control so they don't get to the point where they're having a heart attack, having a stroke, or need their leg chopped off? That would be the kinds of questions I think reform needs to focus around. There's a lot of thinking happening there, but there's probably space for bolder and maybe fresher thinking. Having said all that, money is important. And that's both money to fund the services, and most of that money goes to staff time. We have a huge shortage of staff within the NHS. That's clinical staff, nurses, doctors, pharmacists, other kinds of clinical staff, as well as non-clinical staff. There's a lack of managers. And there's a real sort of appalling sense of administrative and bureaucratic operations within the NHS. And there's probably a lot of waste too. And we need to think a bit harder about, we need to answer the tough questions, right? I think politicians to some extent want to focus on bucket two because they can reform without taking the hard question about, well, population's aging. Many more people are living with multiple conditions. Think it's up to maybe 3 in 4 Britons will probably have a multiple long-term conditions. So I need to double check that stat by the year 2040 or 2045, right? So there's a clear thing here about, well, if a lot more people are relying on specialist healthcare services, how on earth are we financing that? And that there are various options there, right? The most obvious is having the harder conversations on tax and spend. And I think that sort of conversation has to happen too. And that's the one that's probably neglected. Everyone was focusing their energy on this reform question and not enough on the resource question. And what I would argue is that they have to come hand in hand. They must march together, otherwise they'll fail.
You know, recent government reports suggest there is a rise in health inequalities across the UK, specifically after the COVID-19 pandemic. So, I mean, as an analyst, because you look at the sources, what steps and measures do you propose to tackle them?
Yeah, another great, very broad question. So, I mean, I need to actually would have to look up the claim there about sort of to what extent health inequalities have grown since the pandemic. I've certainly seen some literatures on that, but I think the jury is still out. But yeah, health inequalities in the UK are awful, and they have almost definitely been deteriorating for the past 15 years and have probably accelerated or at least continued in that deterioration since the pandemic. So what is to be done? So having said everything I just said about the NHS, it's worth saying the vast majority of health outcomes are not about healthcare services. Healthcare services are absolutely important and you can't ignore them. And there's certainly probably one of the most important aspects of the puzzle. They are still at best sort of a small slice of the overall pie. And what really determines people's health outcomes are the jobs they do, the houses they live in, the social relationships they have. It's virtually every aspect of your life will almost always filter into your health, right? So being able to live a long and healthy life is almost a luxury. It tracks almost perfectly social and economic well-being. So that tells you, okay, well, what do I need to do? I need to try and improve people's social and economic well-being. How do I make people's lives in this country richer and fairer is basically the question. And that's partly in one aspect about a better state and public services. And again, this is, I think, where loads of the attention is from a policy perspective, right? Well, if health outcomes and health inequalities is about more than the NHS, let's improve social care services, let's improve education, let's improve Department of Work and Pension Services, Social Security, those kinds of things that are absolutely spot on. But there's also the how do we make the economy fairer question, right? And then we could be here for days and days and days, right? People talking about fairness in modern democratic capitalism is a big agenda. A lot of that is probably about workers' rights as a starting point. That's probably where you could probably make the most difference, I think, quickly on people's health outcomes. If you massively improve working conditions of people at the bottom, people who are in jobs like carers and cleaners and airline staff, those kinds of jobs where there's very clear impacts on your health and well-being, you can shift the way in which those are regulated. Much stronger workers' rights there would make, I would say, probably a likely impact on health inequality. So those are the kinds of things you can start at. There's clearly low-hanging fruit, but the broader question on how to sort of, if your ideal was to completely remove health inequalities, that's a big question. And then you get into big questions of society and the economy and how we organize them.
Well, that brings us to the end of our segment today. Thank you so much, Dr. Parth, for sharing your thoughts and suggestions on various issues. It's been an absolute pleasure to chat to you. And for our audiences, if you wish to learn more from him, please give his Twitter handle a follow, link in the description below. Wish you all the very best, and thank you for being a part of the discussion.
Thanks, Aid.